Okay, Alexis, I hear you have a patient headed for surgery this morning.
Yes, Ms. Sokolowski, the surgical suite just called. They want one of my patients transported to the operating room within 60 minutes.
Okay. As you know, we have interventions geared towards ensuring patient safety the day of surgery.
Yes. I have the preoperative checklist right here. I was just looking at the patient's health records. I looked up the type of surgery scheduled and the prescribed orders.
Okay. It's important to review the nursing database, the history, and the physical examination.
Right. I checked the baseline data. It has been recorded. Nothing abnormal to report other than the known wrist pain, neurosensory changes, and musculoskeletal issues in the left wrist. The patient is having a carpal tunnel release performed in surgery today.
Has all the diagnostic testing been completed?
Yes, all diagnostic testing is complete. I reviewed the results, and there's nothing abnormal to report other than the small fractures and the arthritis in the left wrist and the expected nerve conduction issues that were identified by the electrodiagnostic tests, all of which are expected with a diagnosis of carpal tunnel syndrome.
Good. Let's gather our supplies.
Okay. Hi, Mrs. McClellan.
Hi, Alexis. Do you remember my husband, Derek?
Yes, hi, Derek. We met earlier. This is Miss Sokolowski, my instructor.
Hi, Mrs. Sokolowski.
Hi, how are you?
So we're here to go through the last checklist to make sure that everything's been done before your surgery. We're going to check vital signs, have you change into a gown, and go over a few questions. But before I do that, let me check your ID band first, okay?
Go for it.
And your full name is?
Isabel McLeland,
And your date of birth.
July 5th, 1974.
Excellent. All the information checks out. You look relaxed. Are you all ready for your surgery?
Well, my doctor said that carpal tunnel release is a pretty common procedure, so I'm not too worried about it.
It is one of the most common procedures performed in the United States. However, we still want to make sure we've gone through the proper safety checks before your surgery. Okay, let me take a look at your consent forms. Okay, they're all filled out. I see the time, date, and signatures for both you and your witness.
Yeah, I crossed all my T's and dotted all my I's.
Yeah, the surgeon spent a good deal of time going over the procedure with us.
Oh, that's good. Do you have any additional questions about the surgery?
No, it's not my first rodeo. I actually had this done with my other wrist, so I know what to expect. Dr. Jahan considered local anesthesia, but due to challenges with my first procedure, she decided to go under general anesthesia this time. So, wrist recovery will be similar. I'll have to wear a brace after surgery, and I'm just hoping to get my grip strength back with this one. I'm really ready for surgery. Non-surgical options just weren't working.
Wow, it sounds like you have a good grasp of what to expect. Did you spend time discussing the risks, benefits, uncertainties, and non-surgical options with Dr. Jahan?
Sure did.
And have you followed Dr. Jahan's food and fluid restrictions?
Yes, absolutely.
And it looks like you do have an advance directive that's been completed. Let me get your vital signs. Okay. Your blood pressure is 118/72. Your heart rate is 88. Your respirations are 16, and your temperature is 98.8. All of those numbers are within normal limits, Ms. McClellan.
This will provide a good baseline for comparison after surgery. Now, if you had noticed any pertinent changes, like a rise or fall in temperature, a significant change in blood pressure, cough, sign of infection, you would need to notify the surgeon right away.
Any known food or drug allergies?
Nope.
All right, Mrs. McClelland. It's time for you to remove your personal clothing, including undergarments, and put on a hospital gown. You can change in the restroom right there.
Okay.
While you're changing, make sure to remove any cosmetics, jewelry, and nail polish.
You also want to remove any prosthesis, like contact lenses, false eyelashes, dentures, and so forth.
Got it. None of that applies to me, so that should be easy. Oh, what about my wedding ring?
The policy about wedding rings varies by facility. Our facility allows you to keep your wedding band on if we secure it with a little tape. But if you prefer, giving it to your husband for safekeeping would be a great idea.
I'll take care of that.
You can give any other valuables to your husband unless you have something that needs to be stored in the safe.
Oh, no, thank you. I'll have Derek hold on to my watch, my wallet, and my ring.
Okay. Also, although we don't want you to drink right before general anesthesia, I'd like you to brush your teeth. I have a toothbrush and some toothpaste. Will you need some assistance?
Oh, no, I got this. Thanks.
Okay, good. You can brush your teeth in the restroom as you change, and then I'll take a quick look in your mouth, okay?
Okay.
Okay, Mrs. McClellan. Did you have a chance to empty your bladder and/or bowels while you were changing?
I did. Thanks for checking.
Okay. Do you mind if I take a quick look in your mouth?
Oh, go ahead.
Okay, can you open your mouth and say ah for me? Great. Awesome. Do you have any issues with your teeth?
Nope. I just went to the dentist last week. Clean bill of health.
Awesome.
Alexis, let's check for any special preoperative orders for Mrs. McClellan.
Okay. Let's see. I don't see any specialized orders ahead of surgery.
Okay.
Okay, let's go over the location of the operation site. Can you show me where the doctor indicated?
Right here. See, just like that one. They'll be twins.
Right. I'll make a note in your health record.
Mrs. McClelland, independent licensed practitioner will actually mark the site once you've arrived in the OR.
So they don't cut the wrong wrist, right?
We have several safety checks built into our process. Okay, let's just verify the checklist. We've verified her identity, identified the procedure site, which will be marked in the OR, verified the history and physical, pre-anesthesia assessment, nursing assessment, diagnostic and radiologic test results, and informed consent forms are in her chart. We verified her allergies and documented her vital signs and made sure all jewelry, contacts, glasses, etc. have been removed. She doesn't have dentures or other implants or devices we need to document. And Ms. McClellan followed the recommendations for the last time she ate or drank anything. Okay, I'm going to sign this form and ask you to sign as well, Mrs. Sokolowski.
Okay, so what's next?
I just checked to see if the physician or anesthesiologist ordered any preoperative medications for the patient.
Okay, any medication for us to administer?
Nope.
Okay, good.
Okay, Ms. McClellan, let's get you in position for the stretcher. Okay. All right, and just stay in bed, please. Perfect.
Hi, Mrs. McClellan. My name is Jalen. I'll be transporting you to OR.
Oh, before you get on the stretcher, let's go ahead and put on some safety socks. I would hate for you to fall, and you definitely don't want to take your socks to the OR with you.
Okay, great. Very good, thanks. Okay.
You're okay on your feet by yourself? All right. All right, we're just going to go ahead and put up these side rails and get you covered up with a blanket.
Okay.
May I check your ID band?
Sure.
Okay. Can I have your full name?
Isabel McClelland,
Okay. And your date of birth?
July 5th, 1974.
Okay.
Okay, Mrs. McClelland, all the preoperative events and measures have been completed. You're all ready for surgery.
Good luck, darling.
Mr. McClellan, after the surgery, your wife will be spending some time in the post-operative recovery area. The surgeon will update you after the surgery and we'll let you know when she's settled, and then you can go and visit her. How about I walk you to the surgical waiting room? It's down the hall on the left.
That'd be great. Thanks, Alexis.